I'd like to welcome Faye Pearce from Right at Home to Marlow FM. Good morning, Faye. Good morning. You've not been here before.
I have not. This is my very first visit.
Well done for coming out today. I'd be tempted to stay in bed under the covers, I think, wouldn't it? Tell me how you got involved in Right at Home.
We're going back to 2014. Single mum. Needed a flexible job to go work around the children, and I'd worked in care previous to that, and it was actually my neighbour who was there Right at Home's very first caregiver that said, "Come and work for us."
Have you noticed more of an uptake on people needing carers these days?
Absolutely.
Why do you think that is?
People are living longer.
True. I thought of that
People
one.
are living longer and
more diseases,
and just need that extra support at home. Really, people want to stay at home.
I suppose, to be honest, years ago you were more integrated in your family unit, weren't you?
Yes.
And everybody looked after each other. Right at Home has a fantastic name in Maidenhead. You know, the carers that come out of Right at Home. I've known quite a few people that have used them. How did it start?
It started with Scott. His father was unwell and decided he wanted to improve care and get involved.
But it's not British, is it?
No, it started in Ohio.
Right.
So there's lots of Right at Homes across America, and then it come over. I think it started 2010.
So it's a franchise, a bit like Janet's, yes.
Yes, franchise. So, and there's around about 80 offices now in the UK.
Goodness me, that is good. So what area does because you're based in Maidenhead by the river, I bet it looks beautiful there today.
It's very lovely, yeah.
Yes.
Very nice.
What area do you cover?
So we cover a good portion of the Royal Borough, and we go all the way up to Stoke Poges, Hedgerley Way, and then we go all the way down to Henley-on-Thames.
Oh, right, so it's quite a big area.
Yeah, so we do a bit South Bucks, and, Royal Borough.
How do you find getting carers and people with the right attitude, training, or do you train them yourselves?
They are very far and few between, and they've got to, of course, pass the mum test.
What does that mean?
The mum test is, would you like them to look after your own mother?
Faye, what type of care does Right at Home provide?
Oh, we've got a wide variety. So we start off with domiciliary care, which is your visits. And they can range from companionship.
What, just going in and sitting talking to somebody?
Yeah, taking them out.
And do you do that? They take them out, yeah.
Yeah, you can sit and talk to them, do puzzles, whatever it is. It's very bespoke to that person's wants and needs, really. So we can go in and talk to them, take them out to appointments, take them out shopping. We've got a gentleman that we take swimming fortnightly. So we've managed to get with Sports Able at Braywick, and they use the hoist to get him in.
Yes,
and the carer goes in the pool with him.
Yeah.
We can bespoke it to anything. So.
Yeah, you do. So you do what's the minimum type of care that you would do for somebody?
So for companionship, we do a minimum of 2 hours a week. You can have that on one day, you could spread it across 1 hour, or 1 hour one day, or 1 hour another day.
And is that paid per hour?
Per hour, paid per hour.
Yeah, right.
And then if you need personal care, then that's a minimum of 5 hours. And again, you can spread that across the week how you want it. You could have 2.5 hours one day, 2.5 hours,
right,
or
okay.
an hour for 5 days, however you want it, basically.
And if somebody needs more than just companionship, what's the next level that you would provide?
So that would be the personal care.
That's the personal care. Yeah. So it's companionship, then personal care.
Yeah, but everything with the companionship is also included in that time giving, obviously.
So would that be getting somebody up, making their breakfast, getting them dressed?
Managing medication.
Right, okay.
Yeah, household duties.
So would they do like cleaning, vacuuming?
Yes.
They include that? So
yes,
that's
we do include cleaning.
Right, that's very good. And then say, what's the next level after that? Because you must have different levels for different needs.
It would be live-in care.
Oh, okay.
So we can have a carer come and live in your house and be there on call. And again, they can be as hands-on or hands-off as necessary.
Sometimes I hear that, they don't, people that do need some help want continuity. How do you cope with that?
Well, we suggest that you don't just put all your eggs in one basket and have one caregiver.
One person you fall in love with, sort of thing.
Yeah. What we do, we'll assign a key worker. So it'll be that one person, but there's a few others, like just a little small pool of carers that will go in that truly know them.
Yeah.
And they can dip in and out and support in case that carer, is not well, their car breaks down, or they want a holiday like we all do.
And do you go, say you have quite complex medical needs, how far can you go down the line on helping?
Well, our clinical training is quite in depth. We do everything from wound care to seizure management, and we can also have additional training for that person. So say we got somebody and we needed that extensive training, we would seek out a professional person to come in and train a pool of carers that will come in and meet that person's needs. So we do everything we can.
Now, you do go out and about as well. You're not just at home, because I know a charity I set up, you actually were coming in and doing the exercises with me. Are you still doing that?
Yes, we are.
Oh, well done.
We are. We do. So we donate a carer to Sequela.
Yeah.
Weekly. So that's to help with the exercises and also moving and handling. So some of the members there need help with
And you do that free of charge, don't you?
We do.
That's very, very welcome.
Yeah. We also do the Stroke Club as well. We donate a carer there to the Stroke Club in Maidenhead. And we also do weekly exercises at Elizabeth House in Cookham.
Right,
alongside our community groups as well. We have 2 of our own and collaborate with Age UK Berkshire on 2 other dementia cafes.
Gosh, and I see here that you've actually, this is right at home. Is it Maidenhead you call it?
Maidenhead, Marlow and Henley.
Okay, you've actually won some awards.
We have.
What have you won? You tell us.
We've won the Work Buzz.
Work Buzz survey and employer winner. What does that mean?
Right.
Does that mean you're good people to work for?
Yes, we are.
Oh, lovely.
We're 5-star. So, yeah, we do.
Oh, yes, that's what the 5 is. Yes, that's why I... Yeah, that's very good. Well, that is fantastic. And then the other award you got, because you are a franchise.
We are.
And that's the Franchise Business Awards winner from the Southeast as well.
That's right, yes.
Yeah, you've done really well. And I mean, Scott obviously is a good boss.
He is. We are spoilt.
You are. I know. I
spoilt.
noticed some of the things he does for you. What else does Right at Home do? Because I know you were just saying about community.
Yes, so we run at St Mark's Church, Methodist Church in Maidenhead. We run a social seniors group weekly. So that is open to everyone. It's £5 to attend.
What do you do?
So we do, like, tomorrow we're doing Sit Fit.
Okay.
And we always finish with a quiz. It's turned into a group of quizzes. We did a quiz one week and it was like, can we do this again? So, and actually one of the members writes the quiz fortnightly. So
good for the brain.
Good for the brain. Yes. So that, and we do different things. Bingo. We've had a cream tea. We had a boat trip down at the accessibility boat at Bisham Abbey. We had fish and chips one week. So we listen and we do feedback forms with them and what they would really want, because it's a group for them. So it's good to have their input of how things are going and what they would like to do.
So how do people get to you? Is that using people to places? Or?
They can use people to places. We can transport our clients to and from. But yeah, otherwise, we can assist with that.
And how long's that for?
It's for 2 hours. It's 2 till 4.
Right.
Every Wednesday at St Mark's Methodist Church. You can give us a call and let us know you're coming, or you can just pop up.
That's companionship as well, isn't it? No
exactly.
need to be lonely.
Socialisation.
Yes.
And alongside that, once a month, every 3rd Wednesday of the month, we run an unpaid carers group called Carers Cafe.
What does that mean?
So unpaid carers are the husbands, the wives, the daughters, the sons, the neighbours, anyone caring for someone who's not paid.
I bet there's a lot of that.
There's a lot of them. It's just a safe space, really, for them to come along.
What, the carers come themselves without the...
Yes.
Oh, without their client.
Client. We run it alongside social seniors. So if they can't leave their loved one at home, they can bring them along and they can go to social seniors next door.
Oh, okay.
And they can sit with us and just a safe space just to speak to other people that know exactly what they're going through and the struggles, because it is hard.
It's a voice, isn't it?
Yeah, I mean, it helps having carers pop in and out here and there, but they're there 24/7. and it's hard going. So
where's that held for?
That's again at St Mark's Methodist
St Mark's,
Church.
okay.
And that's 2:30 till 4.
Right.
And we invite different professionals along to talk about things that they need.
Yeah, so it is good that you care that much. What else do you do in the community?
So we also run 2 dementia cafes. So one in Old Windsor, which is happening right now at the Fox and Castle pub.
Oh, right.
Yeah, so with different venues, so if people with dementia might feel a bit more at home in a just a normal place.
Is that well attended?
It is very well attended. Yeah, that one's very well attended. And the other one is at Bisham Abbey. So that is going to be relaunching in April. And that is on the first Tuesday of the month, 10:30 till 12.
Right.
In the actual Abbey.
Oh, that's
so
beautiful.
It's very nice in there,
Yes.
and that's it's a free event. Turn up, just turn up whenever you like, and just mingle with other people. And there's professionals there as well to discuss about
right
if they want to get any free advice off of anybody.
Is it just elderly people you do, or do you care for children with different things?
Not children. Anyone over the age of 18,
right?
With disability or an illness that they need help with. Or even recovering from an operation from hospital, we can come and do a hospital to home. We can pick you up. We've got a mobility car, so we can pick you up from the hospital, take you home, and even go in beforehand and prep and change bedding or make sure
Fantastic.
Any out-of-date food in the fridge is gone and there's milk and bread and butter and everything else that you need. We can do
good.
all of that. So.
Is there anything else you feel our listeners might like to know that Right at Home provide or, do that we haven't covered? Although I think you've done really well. You've covered a lot.
I think we've covered most of it. But I just think if anyone out there is looking for care, you can always give us a call. No obligations. The same with the initial assessments when our lovely Tracy comes out to you. To do the initial assessment, to talk about what you want.
So that's all free, is it?
That's free. It's no obligation. You don't have to sign away on the dotted line, immediately. It's more advice, getting to know you, and then, you can choose us or you can look at somebody else. But a great place to look for care, if you're looking for care, is on the Care Quality Commissions, so the CQC website. They go through everybody with a fine-tooth comb, all the care agencies, hospitals,
so they're
nursing
DBS
homes,
checked,
and it's the main regulator over any health and social care. So that is a great place to look if you're looking for care, and they give us all ratings. And I'm pleased to say that we're still on our second year. I think we're on target for a third outstanding.
Oh, that's fantastic! A bit like
rating.
Schools, then. That is really
just
good.
Like Ofsted, yeah.
Very, very good. All I can say is, look, Faye, thank you so much for coming. That's really been very interesting for me and for anybody listening. And say hi to everybody. I think you do a fantastic job.